Hey there, YouTube fans. How you going, man? So there's a new, or recently new drug, and the name of it, the clinical name of it is TNX-102SL. TNX-102SL. So the mechanism of action, I'm going to look down at my notes here, and I'll try and leave a link to some information on this. By the way, it's for, if I didn't mention, it's for fibromyalgia, okay? So the active ingredient is cyclobenzaprine, and it's delivered sublingually under the tongue, and it's 2.8 milligrams at bedtime, right, per day at night. So 2 milligrams sublingually under the tongue at night at bedtime. Now, there was a couple of positive phase 3 trials, and it improved the big three that we suffer in fibromyalgia. So sleep, pain, and fatigue. Those three: sleep, pain, and fatigue. Now, one of the things I realized is this isn't exactly new drug, but I think the way that it's delivered is novel, new. So if I'm not mistaken, right, it's actually one of those muscle relaxants that they do give to fibromyalgia patients off-label, right, if I'm not mistaken. And I noticed also there was some kind of histamine action, antihistamine action, and also muscular action. So I think relaxing of the muscles, right? It's not out on the market. They've fast-tracked it with the FDA. So hopefully maybe next year in 2025, as I'm doing this video in 2024 in December. It was fairly well tolerated, except for like localized problems like numbness of the tongue and things like that. I think dry mouth was the other one. And the issue with having it, the benefit, I should say, of having it sublingually is instead of other forms, which it is available, which I'm going to try and remember to talk to my doctor. So if you have it sublingually in low dose like that, then you have less chances of side effects because it bypasses the liver, okay? That's part of the reason why you have less side effects. It bypasses the liver, so it goes straight into the bloodstream under the tongue. So it was also helpful apparently in PTSD. So my phone's going off, sorry. So those are the few things. Now, if you can't wait, maybe you can talk to your doctor about having a cyclobenzaprine, which I believe, if I'm not mistaken, it's a muscle relaxant, which it is used off-label, as I said, for fibro. I'm not sure of the dosing though in that capacity, right? And that might be something that I could talk to my doctor about as well. I'm just really afraid of side effects, which always seems to be the case when you're a fibro sufferer. So I'm going to have a think about all of that, and it works. While I've got this info in front of me, it works, primarily interacts with 5-HT2A, A1-androgenic, and H1 histaminergic, and M1 muscarinic receptors. So it seems to me like 5-HTP, which I did try that in the past. Androgen, which is a norepinephrine, something like that. And histamine, that's another reason why I found antihistamines, for example, cetirizine. Sometimes when I take cetirizine, this one, I was like, how can I feel better today? Because it has antihistamine effects. It looks like that may be part of the the problems that we have in fibromyalgia. We have a kind of histamine reaction, by the way. So it isn't in my head that cetirizine antihistamine, I've taken half a tablet, a full tablet, and all of a sudden that day or the next day or both days I feel better. That seems to be part of this research, by the way. So it's not in my head. The therapeutic goal is to improve sleep quality of this TNX-102 SL by addressing underlying mechanisms of sleep disturbances, particularly in conditions like fibromyalgia. Better sleep means less pain, means more restorative sleep, and what was the other one? More energy, so less fatigue. All right, I hope that helps. I will try and add some link in the description of this video to share that the company, who was it? They did mention the company, Tonix, Tonix Pharmaceuticals. Tonix Pharmaceuticals. There are PubMed articles. In fact, I'll just click on this and I will copy this link and I'll put it in the description, right, of my video. I'll just quickly copy that. All right, well, I'll leave it there. Tell me what you think. Tell me if you're going to try it. Tell me whatever you're doing. Please always check with your own doctor before you do anything. I don't think this drug is available like that in the sublingual form yet, but it might be something worth trying in the future, and I just wanted to share that information with you guys. How I come across this information, one last thing, was I was looking up, is it possible that cetirizine antihistamine makes me feel better? And it came up with that TNX-102 SL. All right, hope that helps. Please remember to like, comment, and subscribe. Teach us out. God bless. Ciao. Have a good Christmas. Ciao.